It's a prolific rap sheet.
January 17th.
Amber McPherson pieces together the paper trail left by her brother, Curtis McGowan.
Withdrawn.
Pages of petty crimes.
Breach. Was arrested again. He jumped off the stretcher. That's when he broke his foot.
And emergency admission records.
Recently arrested, ×3 this month. Says stealing to supply his habit.
McGowan's addiction began as it did for a lot of drug users, with a prescription for pain medication.
Here's Mom and Dad and Curtis.
He then bounced between his family, the street, the hospital, and jail for almost 7 years. Then, the vicious circle of probation, overdose, and rearrest ended last fall.
Someone found him laying on the street in Guelph and called the ambulance, and they took him to the hospital here in Guelph, and revived him with the
Narcan.
And the police were there to arrest him because part of his probation is not to use drugs.
Released and busted again just days later, McGowan landed here in a cell in the infirmary for a broken foot, close to medical attention, not close enough to prevent an overdose on fentanyl. When staff found him, it was too late.
Why was my brother dead in the medical unit? And they check them every 20 minutes with a log thing. They go by. So I want to know, how did this happen? Like, I think we deserve to know that.
Like, I find it amazing that he survived an overdose on the streets but dies of one in jail. Not even like 6 weeks later.
They really need you to help me.
McGowan's family says he was desperate for treatment but didn't get it.
I really hope to hear from you and maybe see you.
Without it, he stood little chance against the temptation of drugs, smuggled behind bars in increasingly creative ways.
He did tell me some things how they get them in, which was in Kinder eggs and swallowing packages and people getting bail and then getting arrested again or going back in somehow.
Ontario is stepping up its efforts to keep drugs out by bringing in full body scanners.
So here we've identified a piece of contraband that doesn't belong.
Like this one recently installed at the Remand Center in Edmonton.
Now as we apply the different filters.
But cutting addicted inmates off drugs has consequences.
Forcing them to be sober, you're not doing anybody any favors. That's just another dead body, because the risk of overdosing when you're released from prison is up to 40 or 60 times higher than the general population, which is ridiculously high. So you've been taking clonidine lately at all?
This former correctional doctor says physicians are reluctant to offer addictions treatment in provincial facilities where the sentences are short and the population transitory. Her survey found just half of the doctors in Ontario jails provide drug treatment such as methadone, and in most cases, only if that inmate was already in treatment prior to jail.
Some of them don't see that as their job. They see their role as being primary care providers. This is sort of like a walk-in clinic type setting. I'm going to deal with the urgent issue. I'm not here to prevent anything that happens in the future necessarily.
Those apprehensions and preconceptions are no longer valid, in my opinion, in the context of the present crisis.
Dr. Nader Sharifi works in BC's correctional system, not as a corrections employee, but under the Ministry of Health. 6 months ago, BC followed Alberta and Nova Scotia's lead by taking the responsibility for inmate health out of the hands of jail administration and giving it to the Ministry of Health to ensure the standards for care are the same behind bars as they are outside. Since then, Sharifi says no one has died of an opioid overdose in BC jails. A third of provincial inmates are now getting treatment for addiction. But it's still early, and there's a waiting list.
We look at Suboxone, we look at methadone as a drug, but it's not really a drug. If you were diabetic and you were on a medication called insulin, I wouldn't want to cut back your insulin dose and expect you to do well.
The Ontario government says it's also looking at shifting responsibility. Too late for the 8 men who died of overdoses in one provincial facility alone. They're the subject of an inquest next week. A separate investigation is also underway into Curtis McGowan's death.
I am so tired.
For now, the answers his sister has are in his last letter to her, penned in jail.
What I'm trying to say is I need help, and I don't like asking for help.
help that never came. Vic Adopia, CBC News, Guelph, Ontario.
Now, Vic mentioned 8 deaths at one Ontario facility. We asked the province for the total number of deaths, but didn't get an answer. Instead, the ministry told us that it's reviewing how best to track overdoses, and this is an issue beyond Ontario. BC Corrections told us between 2016 and 2017, its staff dealt with 96 suspected overdoses that were non-fatal and 4 that were fatal. In Alberta, between January 2016 and November 2017, there were 122 suspected overdoses. 3 inmates died.